Spicy.
Shadle's table spicy. This is a serious issue here.
Oh, man.
That's a good one. Oh my God. So you want to be a body worker. Welcome to Shadle's Table. Today we've got a really cool case study. I've gone through his intake form and he's been through a lot. And I can relate to this situation. He's had neck surgery. All of his symptoms are on his left side. He's already had neck surgery and he had 2 discs replaced.
I first noticed it when I was exercising. I was doing like these football runs where you have to tap your feet really fast, kind of going through like the tires, you know? Mm-hmm. And all of a sudden I just realized my right foot's just going like nice and rhythmic and even and making fast as I want. And my left side would skip a beat, and then it just started to not just do so well. So it kind of freaked me out a little bit. So I got some MRIs. I've got 3 compromised discs, degenerated discs. 4 doctors wanted to do fusions, 3 at once, with this cage, you know, inside. And I was like, oh, I don't want to do that right now. Alternatives? Yes, there's these artificial discs you can actually have. So I had that surgery in the end of March. So no relief whatsoever, like 0 relief. So still have this dexterity, fine motor skill problem.
Shaky.
Now, after the surgery, this wasn't here before, now I have this like shaky thing. When I internally rotate, it kicks in even more.
Mm-hmm. We got 90 minutes. We're trying to figure out what we can find. Just by the fact that you telling me, you know, you're playing guitar and doing some sporting events, I'm going to be looking for these patterns. I'm going to be trying to unravel these patterns. So I'm kind of just seeing how his body, his overall body feels. Is his nervous system stressed? Check his forearms. Lots of tension in the forearms for sure. He's spending a lot of time there. Checking the glutes. Looking for anything that stands out. Yeah, right glute feels tighter than the left glute. Yeah, right side's for sure more patterns on the right side. I'm gonna work on his feet right now, actually. Let's see. So yeah, just nice big breaths. Long, full exhales. So I'm just trying to put a little more emphasis on his right side. Feels like his right side has a lot more patterns. Said he's right side dominant. Played baseball. How you doing with that, Jeff?
Feels fine, yeah.
Okay.
I feel like I felt, you know, the sensations shoot right up to my right ear. It's kind of wild.
Yeah. I use my heel right in the arch. Create a little bit of friction. Just grab onto the fascia with my fascia. You feel any different between the 2 sides?
They're pretty close as far as sort of sensation, you know. Maybe the right is a little more tender. Still intense, but a little less intense.
Good.
Yeah.
Now I just check the calves, work our way up. Usually one leg or hip will turn out a little bit more. It feels like it's the right one here. I can feel that there. That's that line that we were feeling there. My favorite sayings is it's the pain that you don't feel is far worse than the pain you do feel. It's taken me a long time to kind of really own that.
Yeah, right.
Wow, lots in his right adductor magnus area, inside hamstrings.
Oh yeah.
Big time. So we can see left ankle, got some movement here. Maybe not so great dorsal flexion. Ankles are a big part of this equation for sure. Inversion, eversion, much worse on the right side than the left side. So the fact that this is tight, his whole outside line is going to be tight for sure, all the way up to that hip for starters. We're just going across all those fascia that connects and separates our calf muscles, our gastroc, our soleus, our peroneals. And coming up here through the glute. Right glute feels real tight. Feels like a lot of buildup around the hips.
Yeah.
Welcome to the party. This whole lateral line is something's going on there, all the way down here. Probably into the outside of the foot. A little bit there in the left hip. Yeah, it definitely feels the right hip needs more of that than the left hip, I'd say. This guy's a champion, so he's gonna get more ashiatsu today.
Nice.
So we're gonna feel his hands here. Yeah, your wrists feel kind of stuck. Check the forearm here. Yeah, scapulas feel a little stuck. Same thing on this side, just using the outside of my foot blade right in the arch of his hand. Spicy.
Spicy.
Shadle's table spicy. We just want more things to be supple and gooey, sliding and gliding. This is a serious issue here, so he has no wrist extension. No wrist extension, gonna have no spine extension. So that's gonna be a major thing for him to work on here. You wanna check wrist extension. So really same thing here. Tight flexors, fingers not extending. Wrist, it's really the wrist. Fingers are not too bad. So he's here a lot, right? So he's playing. You can see some big twitching there. You might see some twitching here. Yep, there we go. Nice. Good. I'll let that go. You got a lot to work with, my friend. Good job. Yeah, definitely getting some more movement through the spine. So he was saying he couldn't do the chair pose, so arm comes up, spine extends, shoulder flexes, and he's just can't do it here. His arm is just weak. So if we struggle to get into full flexion, maybe it's because our extensors are tight. Yeah, let's try a little pinching. Oh wow, there's so much in there. This will make your shoulder feel like it's going to explode. You see some big twitching there. And you just see that muscle firing up. I'm just using the elbow here, push it right on that teres major. Can see it twitching like crazy. Once I feel like I'm on a really good spot, I'll just try to hang out there, try to be as comfortable as possible. Just trying to free up that scapula a little bit more. Traps, rhomboids, rectors, they're all kind of a little stuck together. Just trying to stretch his extensors. So internal rotation, flexion of the wrist. Making a soft fist to stretch the front and the elbow. Also to just passively see that his hands and his wrists are very tied up. Same area. Teres major. A little bit of lat. Mostly teres major. Sucker stuck. He's got some developed lats for sure. They're just restricted. So again, that's going to be part of what's restricting this middle back. If you think of like rock climbers, they have massive lats. They're like the worst hunchbacks, you've ever seen. Also have a lot of neck problems. There's a lot in his posterior deltoid on the right side. Trying to pin that down. Maybe pin it down with the knuckles. Yep. Wow. That's a good one. Yeah, and we got to get to this shoulder. Oh my gosh. Oh. Yeah, on the front, man. Oh my God. Let's see here. Just pushing the fascia, rectors, lats off the spine. Also just kind of seeing that there's a little more springiness to his spine, which there definitely seems to be a lot more movement. Yeah, left side feels like it's opened up nicely. Let's have you really slowly slide down, flip face up. Sorry to be a little bright. Feel okay? Yeah. You okay if I go over on time a little bit? It might make you late for anything?
That's okay. Oh, man.
Yeah, that's significantly worse on this side.
Oh.
I can feel those patterns. See, he's got no internal rotation in the hips.
Popcorn.
Yeah. Yeah, so oddly enough, I, won't really do much to your neck. That's kind of usually how it works, though, All right. Yeah, we'll just take your time, man.
Oh, yeah. Good stuff. That's also confusing.
Yeah. Let me see you do one thing out here. Come out here real quick. Yeah, I mean, are you able?
Okay. Well, anyway.
Yeah.
Wild, huh?
Yeah. That's a riddle to solve. So yeah, so walk back that way. Yeah. So see if you can get a stretch here. So being in this position more often, I think, would be good for you.
Yeah.
Because it's going to help open this up. It's going to stretch this. You can even put your thumbs on the other side. Might even add another level to it.
I like this.
Yeah, put them up. Yeah. Yeah. And then you could try on the floor, like stuff like this.
Yeah, I do that when I'm in yoga.
Yeah.
Like the tabletop, I'll flip over my hands.
Yep.
Do this.
So I think when you get back into your routine, you might tie those things in.
Yeah, cool. Fantastic.
Yeah.
Thank you, sir.
Yeah, for sure.
That's great.